COVID-19 accelerates ongoing digital transformation efforts at NYU Langone. So NYU was one of the first hit downtown New York City. And let me just give you some of the story. So because of its investments in its foundational technology, NYU Langone in New York City was able to quickly scale its digital solutions, not only to meet clinical demands, but also to develop ways for patients to access care despite the physical restrictions inherent in various pandemic protocols. NYU Langone experienced significant growth in digital engagement as a result. Nader Merabi, who has been on This Week in Health IT, is their EVP, Vice Dean, and Chief Digital and Information Officer. My gosh, he has 4 titles. That's a lot to do. I spoke on this issue at HIMSS 21 in Vegas. It was titled Riding the Wave of Digital Transformation, How Technology Can Enhance the Patient Experience. And he said, in the past 8 years, we've focused on building the fundamental platform of digital infrastructure, from EHRs to connecting in the cloud in the right way to AI and machine learning. All of these fundamental building blocks you need, said Merabi. You need to build your digital experience on top of that. A sound digital strategy, he said, is about synergy from the operations team to the technologists, and even marketing. All constituents need to work together towards a common goal. All right, so let's stop there. There's a lot in this. And I do want to read a little bit more later on what NYU did. But if we stop there, what is it? I mean, there's 2 key points here. One is they were able to scale because they had put in the right fundamental platform. And so what does that mean? And we talk about synergy of operations. And we actually talk about it a lot on the show, because people will tell me that's an operational project or that's a clinical project. And what we used to do is everything was an IT project that had clinical involvement. And now we're starting to recognize that a lot of these are operations projects or clinical projects that have an IT involvement, which is a completely different way of approaching these things. So You picked this story. What struck you about this story?
So I think, like you said, a couple things jumped out at me. Was one, that NYU Langone had the foresight to pay down their technical debt early on, and they were really bringing in an infrastructure, a core IT infrastructure that can support not just cloud, but AI and other initiatives that they were looking at to do. They knew that they had to do that to be able to grow and be competitive and all that stuff. And I think one of the things I heard at HIMSS in the Future of Healthcare presentation was new technology plus an old organization is a costly old organization. Okay, right? So I think they saw the crystal ball. They knew that this had to not be the case, and so that was one thing I think they did, exceptionally. The other thing is their thinking when it comes down to collaboration. So whatever the objectives are and the projects they're bringing in the right stakeholders, the end users, and so they call it, I think, design thinking, which is really human-centered process of problem solving. And so they do that and bring in all the right stakeholders so IT supports, right, a lot of these initiatives, whether it's clinical, where it's on the business side, but IT supports that, looking at the current infrastructure and what tools do we have to actually solve the problem. And then on the end user side, is it going to cause more friction? Does it reduce the friction for all those people that are involved? So I think that's really the 2 points that jumped out at me on this, and kudos to them for really driving and being ahead of the game here.